Today our topic of discussion is physiological factors affecting blood pressure. But first of all we will discuss what blood pressure is. Blood pressure is the pressure, measured in millimeters of mercury, within the major arterial system of the body. Now we will discuss normal values of blood pressure. Blood pressure is recorded as two numbers, such as 120/80ths. The first number is the systolic blood pressure, which is the pressure when the heart beats, while the heart muscle is contracting, squeezing, and pumping oxygen-rich blood into the blood vessels. The second number is the diastolic blood pressure, which is the pressure on the blood vessels when the heart muscle relaxes. How is blood pressure measured? A medical professional uses a stethoscope and a blood pressure cuff to measure blood pressure manually. The cuff is placed around the upper arm, with the bottom edge just above the elbow. The professional then inflates the cuff using a hand pump or by pressing a button on an automated device. As the cuff inflates, it squeezes the arm, stopping blood flow for a moment. The professional then opens a valve to slowly release air from the cuff, restoring blood flow. The professional continues to listen to blood flow and pulse, and records the blood pressure. The professional will first listen to the pulse in the arm's brachial artery. The cuff should fit snugly around the arm, but shouldn't be painful. The cuff will inflate quickly, and the professional will feel tightness around the arm. The professional will then slowly release air from the cuff while using a stethoscope to hear the pulse. The professional will take a measurement when they hear blood moving, and then release more air from the cuff. The professional will then measure the pressure again. The first reading when the sound of blood pulsing is first heard is the systolic pressure. The point at which the sound stops is the diastolic pressure. Here, the question arises, what are the factors affecting blood pressure? Many factors can affect blood pressure, including age. Older people are more likely to develop high blood pressure. Genetics. Family history can increase your risk of high blood pressure. Sex. Men are more likely to develop high blood pressure than women in middle age, but women are more likely than men to develop high blood pressure in older age. Lifestyle. Unhealthy diet. Physical inactivity, obesity, and drinking too much alcohol can increase your risk of high blood pressure. Chronic conditions, kidney disease, diabetes, and sleep apnea can lead to high blood pressure. Stress. High levels of stress can temporarily increase blood pressure. Medications. Some medications, like cough and cold medicines, can cause blood pressure to rise by constricting arteries. Now, let us move towards our main topic. Blood pressure is affected by a number of physiological factors, including cardiac output, peripheral resistance, blood volume, vessel diameter, age, sex, sleep, body build, meals, exercise, and emotional conditions. Cardiac output determines the amount of blood to be carried by the blood vessels. In a normal situation, it is approximately 5 L. Any increase in cardiac output will, in turn, increase blood pressure and thus promote blood flow. Peripheral vascular resistance, SVR, is the resistance in the circulatory system that creates blood pressure and blood flow. SVR increases when blood vessels constrict, vasoconstriction, and decreases when blood vessels dilate, vasodilation. Reduced blood volume leads to collapsing vessels, reduced pressure, and subsequently reduced perfusion pressure. The cardiovascular system combats low blood volume by constricting blood vessels until the body reaches a blood pressure that restores proper perfusion pressure. In blood vessels, most of the resistance is due to vessel diameter. As vessel diameter decreases, the resistance increases and blood flow decreases. Very little pressure remains by the time blood leaves the capillaries and enters the venules. As people age, their blood vessels become less elastic and stiffer, which can cause blood pressure to rise. The average blood pressure increases from 120/70ths to 150/90ths, and may remain slightly high even with treatment. According to the Mayo Clinic, people who sleep 6 hours or less may have steeper increases in blood pressure. Sleep helps the body control hormones needed to control stress and metabolism. If you don't sleep enough, your body can't properly regulate these hormones, which can lead to high blood pressure. Being overweight or obese can cause changes in the blood vessels, kidneys, and other parts of the body, which can often increase blood pressure. This is because excess weight can cause resistance to flow, which is when more pressure is required to move blood around the body. People with fat around their abdominal area are at greater risk of developing hypertension. Often, your blood pressure is higher before eating because after you eat, blood pressure typically drops as blood is diverted to the digestive system. While eating a meal usually causes a slight drop in blood pressure, intermittent fasting sometimes lowers blood pressure. Exercise can lower blood pressure by making the heart stronger, which allows it to pump more blood with less effort. This reduces the force on the arteries, which lowers blood pressure. The effects of exercise can last up to 24 hours after the activity, which is called post-exercise hypotension. Regular exercise may ensure a 5 mm of mercury decrease in blood pressure. Emotional conditions like stress, anxiety, and depression can cause blood pressure to rise. This is because the body releases hormones in response to stress, which can cause the heart to beat faster and blood vessels to narrow. This is known as the fight or flight response, which may have evolved to help us escape predators. Thanks for listening. I hope you understood.